and starting recording. As a reminder, this is a public meeting, so we will be recording it, and there will also be a transcription available in our meeting minutes. So, hi, welcome. Today, July 22nd, you all are here for the Impacts Grant Review Committee meeting regarding program enhancement requests. It's great to see everyone. Thanks for being here. I have a small update for the record. I recently got married, so my name is now Casey Beck. Obviously, still the same me, but just wanted to give everyone a heads up that I have a new last name that you'll be seeing pop up on emails and such. So let's hop into business. Jenny, why don't you officially call roll, just so we can have it for the record?
Sure. Steve Allen.
Here.
Ken Sandgren.
And congratulations, by the way.
Present.
Jeremiah Stromberg.
Here.
Judge Shanti.
Here.
Eric Swallow. Commissioner Hall.
Here. My apologies for the delay.
No problem. Alicia Beamer.
Here. And congrats, Casey.
Stacy Brubaker. Dr. Brigham.
Congrats and present.
Sheriff Landers. Dr. Stanfill.
Present.
Senator Gelzer. Janie Gullickson. RJ Navarro. And Jaron Riddle.
Here, congrats.
Thank you all. And that's 9. So we officially have quorum and we can do some impacts business. So I'm going to speed through this meeting overview. As you can see, the agenda is here. The majority of this meeting is going to be focused on the program enhancement requests that we didn't get to at the last meeting on May 23rd. So as a couple of reminders, during that last meeting, the current service level funding was awarded for all of the current grantees, the 2020 to 2022 grantees, their impacts programs, and the project period for those have been extended through June 30th of 2024, so 2 more years. And we got through 1 of the 5 program enhancement requests, which was Clackamas County. So Clackamas County has been reviewed, they've been approved, and we have 4 more to get through today. In the interest of time, we are going to be moving forward with the voice voting process once again. So we won't be calling roll for each vote. Just, there's 9 of you, so it takes some time. Instead, I will make sure that I articulate exactly what you're voting on. There's no need for motions. And then I'll give an opportunity for anyone who wishes to announce an abstention. Then I'll ask for those in favor to say aye, those opposed to say nay. And Jenny will be helping me record who's saying what, just so we can keep track of which votes pass. All right. Picking up right where you left off.
Quick question.
Yes.
Yep, not to slow us down. I appreciate the wanting to move at full speed. I assume after declaring what the motion would be, that there would be a moment opening for discussion prior to the vote.
Right, yeah, so there's no official motion that I'll be saying or anyone else needs to say, but the vote, I'll be like, hey, for instance, if we were doing this one right now, I would, let everyone know that the vote in front of you is to approve the program enhancement request for Grand Ronde at the funding amount of blah, blah, blah. Are there any questions, further discussion, any abstentions? Kind of have that moment.
Perfect, thank you.
No problem. So for those of you who were in attendance at that May 23rd meeting, we started to get into this, but didn't quite. So in review, The Confederated Tribes of Grand Ronde have a program enhancement request with a funding amount of $380,000.04. This primarily covers an increase for client substance abuse treatment services. During that May 23rd meeting, Co-Chair Allen had inquired whether or not they're able to bill OHP Medicaid for services that they've provided. And we have since reached out to Grand Ronde with that question. Their response was that they, of course, definitely prefer to use OHP first for their tribal members who qualify. They did note that there is a serious shortage of OHP beds for treatment at this time. They're on long waiting lists to get members in. And additionally, these facilities often don't address co-occurring diagnoses. So with that, if they need to get members into treatment quickly, they do have to resort to other funding streams to cover the cost. So is there any further discussion on Grand Ronde? Any questions?
I have no further
I
questions.
have a question.
Yes, Judge Shanti.
That answer doesn't make sense to me. So I need, it makes sense that there's not enough treatment beds because there's not enough treatment beds. But it doesn't make sense to me that you could get someone into a program that's not Oregon Health Authority unless what they're talking about is the problem about transferring from one insurance from one county to another. So we have a very discombobulated approach. If you have insurance for Lane County, but there's no place that's available and you find a place in Multnomah County, you got to change your insurance from Lane County to Multnomah County. But OHP will still pay for it. It's just that you have to change it. So I'm trying to understand is what they're saying is that the impediment, the structural impediment, because the way we've got it organized isn't very effective and efficient given the shortage of beds, or are they saying something else?
Thanks, Judge Shanti. Oh, go ahead, Chair Allen.
Yeah, well, I was just waiting to see if you all had additional information. Otherwise, I was going to weigh in. So just wanting to pause for you first.
Thank you. I only have the information that they've provided here on the slide, so thanks.
Yeah, Judge Hunte and others, the way I interpreted the answer, rightly or wrongly, was that the Confederated Tribes would access, Medicaid funding where that funding is ready and available, but what they're running into is the need for care when that care can't be provided by a Medicaid certified provider, and so they're trying to fill the gap. I think what I would expect and sort of add to my yes vote is just to ensure, if we don't already have it in the language, and I think we probably do in the rules, is that all impacts programs seek other sources of funding first, including Medicaid, and use these funds to provide services for folks that are authorized when those other means of reimbursement are not available. I think that's already in our rules, is it not?
That's ringing a bell for me as well, Steve. I don't have the rules up in front of me, but I believe if it's not in the rules, it's definitely in the RFGP about seeking Medicaid, first.
Well, Steve, can you tell me, are there programs that treatment programs that don't qualify for public insurance, for Oregon Health Authority insurance, OHP?
Yes, and I think among those, and this is a bridge that we're working with the tribes on, is that there are tribal-based practices that aren't yet Medicaid reimbursable that we're working on becoming Medicaid reimbursable, and so there may be avenues there. There are programs that aren't certified yet as Medicaid providers, or maybe are currently ineligible to be certified as a Medicaid provider. In some cases, peer organized services that are not part of a broader multidisciplinary team are not always Medicaid reimbursable, so that there are healthcare provision of behavioral health along with some others that aren't reimbursable at this time. And I think what we do then and what we would offer to the Confederated Tribes is to provide some technical assistance to see whether or not the services that are provided could be brought in as a Medicaid provider or enhanced, or whether it's the work on tribal-based practice work that's currently in motion that just needs to move forward to reduce the drawdown for these funds and have them go further for the tribes and others.
Thank you.
You're welcome.
All right, do GRC members have any further questions or discussion? If there are no further questions, we'll go ahead and proceed with the vote. So the decision before you now is whether or not you approve this program enhancement request. The financial cost is $380,000.04. From here, I will proceed to ask, if there's any further discussion, as well as for anyone to announce abstentions. All right. All those in favor of approving the program enhancement for the Confederated Tribes of Grand Ronde, please say aye.
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 Great. And those opposed, please say nay. Okay. Jenny, do you got that down okay? Awesome. All right, so that vote passes. Next up for discussion is the Douglas County Program Enhancement Requests. So the total funding request here is $649,499.96. This covers a variety of different things. First, there would be a 0.5 FTE therapist position. This therapist position is a QMHP, and they'll be working with local hospital on safety and discharge planning of the cohort members belonging to the Douglas County Impacts Program. The next part is a 0.25 FTE Umpqua Health Management Data Analyst position. The data analyst will be responsible for managing the Tableau feeds from Collective Medical and the jail, along with claims data and producing reports and dashboards. For those of you who aren't familiar, Douglas County has been working with Umpqua Health Management in the past year to work on these Tableau data dashboards. They track their cohort members, and they have set up a jail feed to see if people are getting booked into jail, if they're visiting the emergency room, using the Collective Medical software for alerts, and then basically, displaying that data in a way that it can be analyzed and shared. So this 0.25 FTE position would be dedicated to that project, which they currently do not have. They've kind of just been in a pilot period of like, does this work? And it has. So in addition to that data analyst position, they're asking for the Tableau data dashboard server and license, as well as a fee to be paid to the jail for a specific software that provides real-time booking info to be included in the Tableau platform. So it's basically to the jail, excuse me, not to the jail, but to the jail software provider so that they can talk with the Tableau dashboard. And the last portion here is a motel purchase and renovation for short-term housing and shelter. And that's located, right downtown and would serve as that temporary housing for any, cohort members who needed it. Is there any questions or discussion?
This is Jeremiah. Just wanted to ask, do we know who will be managing or overseeing the motel short-term housing? Will that be through Adapt or another entity?
It will be through Adapt.
Okay. Thank you.
And for those of you who don't know, Adapt is kind of the behavioral health service provider. Douglas County works with them on a variety of other things. The sobering center, stabilization stuff. They're the main source of behavioral health service provider in Douglas County.
Yeah, this is Steve. Just first and foremost, I really like this additional package between the data and additional housing build out and interconnections that are implicit here. Just a couple of questions. One is if anyone from Adapt could comment a little bit on the cost of the positions, whether that's purely salary or others. It's close to $250,000 for the therapist position if it was a full FTE, and some $300,000 roughly, or a little under that for the data management position if it was a single FTE, on a prorated basis. So I assume that there's more in there, but just a little bit more detail. And then this is a policy question for the group, and I'm forgetting the rules and arrangements that we've made. We're doing a lot of this at OHA, so this is fresh of mind for me, where public funds are used for a real property renovation or purchase. What are our current guidelines around, say a lien on that property? Typically what we do at OHA is a 20-year lien, and that's prorated year over year, as long as it's used for the intended purpose. So if it's used 10 years and then Adapt were to sell off the property, they would still, owe, half of the approximately $400,000 for about $200,000 back to the state. So some arrangement like that is pretty common. I just am forgetting whether we've built that in or whether we would make some arrangement similar to that here.
I don't recall us building that in, but I do recall us having those discussions early on about not with buying buildings, but like buying vehicles and things like that, about what happens if it's not, the program doesn't continue or something like that. I think, Steve, your idea of some kind of lien that ends up with Adapt having to pay back the state if they discontinue the program or something like that is a good one. And also I agree as to the question about the therapists, because that's a lot of money. If you just multiply that to one FTE, that's more than what I think the market bears for these folks. And so I'd like to know really, what does that FTE represent? Steve, you probably know what the going rate is in the various locations of Oregon, don't you? Or you have access to the information if you don't know it off the top of your head.
Yeah, I know it varies widely, and it's not necessarily cheaper in more rural areas of the state. So I know we need to, and we've been with the legislators help work to increase wages so we can recruit and retain in a really difficult employment market. So I'm not opposed, but I just think for the purpose of this discussion, that would be helpful to have a little bit more information.
I noticed that Sue Goldberg and Melissa McRoby Toll are both here. Do either of you have an opportunity to weigh in?
Yeah, I
Yeah.
see Sue had raised her hand, so I'm going to let her go first.
Thank you, Melissa, and thank you for inviting us to join today. On the staffing costs, those are for the biennium period. So that's a 2-year term.
There you go. Okay,
Yeah.
perfect. Okay,
You're
that
welcome.
answers. Thank you.
That's what I was going to say as well, but I can answer any other questions that come up.
Awesome. I should have guessed that answer, but thank you. I'll just say that I support this, but would ask that we have a strategy for securing the housing investment. And again, at OHA, we've been working on this diligently over these last months with a lot of infrastructure investments, and could offer a solution that I think would be acceptable to adapt in Douglas County and consistent with other property purchase, current property purchase strategies that we're using in OHA, if that's acceptable.
I'd just like to briefly say, I don't think we have anything in our rules that would require that, Steve, looking those over briefly during these discussions, but if you could forward any of that contract language to us, then we can work with ADAPT on coming to an agreement on that piece.
Okay, I'll have our people talk to your people.
Great, thank you.
Are there any other questions or discussion?
This is Alicia. I mean, when I look forward to seeing the outcome metrics from this, I think it looks like a great project. It's just really looking forward to seeing how it really improves the lives of those they're serving and the outcomes that we're looking for. Thanks.
Yeah, thanks, Alicia. I know that Ken and I have kind of tossed around the idea of inviting Douglas County to present to the grant review committee, maybe in autumn, since we're a little bit busy this summer. But I know both Sue and Melissa are here, but they're more than happy to, show you what they're doing and talk about the outcomes in their jurisdiction and kind of give you a tour of those data dashboards. They're very impressive.
That'd be great. And is it also it's great that it's including the jail software, but will it also include emergency department visits? And
yeah, they utilize Collective Medical.
Okay, great.
Yep.
Yeah, look forward to seeing what comes out of it. Thank you.
All right, if there are no further questions, we will go ahead and proceed to the vote. Okay. The decision before you now is whether you approve this program enhancement request for Douglas County with the financial impact of $649,499.96. Are there any further discussion or announcements for abstentions?
Casey, this is Greg Brigham. I'm going to abstain.
Thank you, Dr. Brigham. Jenny, if you could please note that down.
This is Sharon Stanfill. I think I should as well because we work really closely and they do a lot for the tribe. So I should abstain.
Thank you. All right. All those in favor of approving the program enhancement for Douglas County, say aye.
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 And all those opposed, say nay. All right. Thank you. That passes. Jenny, do you have that noted down? Okay to move on? All right. Next up, we have the program enhancement request for Union County. So this is a request that has no financial impact. They are requesting to reallocate $155,388.84, which would replace their underutilized 0.5 FTE Union County Community Corrections Release Officer and the to date unfilled 0.5 FTE Parole and Probation Housing Coordinator, as well as using about $2,700 of other funds there to repurpose those to create a new work crew deputy position. And that, does anyone have questions about, what work crew is?
Yeah, I do.
I
It'd
have
be
other
helpful to hear-
questions.
Okay. I'll start with what work crew is, and then Judge Shanti, I'll invite you to ask your questions. So work crew is an alternative sanctioning tool, primarily used for stable populations and usually in lieu of jail days. So work crew is, you're being trusted by the county to show up on time, not run away, utilize tools, that sort of thing. So for this particular request, had support from both the Sheriff's Office and Parole and Probation. The work crew program currently runs Sunday through Wednesday and is used as a secondary way to sanction individuals instead of spending time in jail. Both the behavioral health courts and the drug courts of Union County utilize work crew to keep people from entering jail. And Union County says that if this position was created, the work crew deputy can cover the other 3 days, the Thursday through Saturday, and would open up, an opportunity for individuals to use work crew. So that's what work crew is and what Union County has requested. Judge Shanti, you had a question.
In our prior discussions, we talked about whether or not we thought funding law enforcement positions was consistent with what the goal of the impact grant funds are. When I think about, one of my first questions was, do they have a drug court and or mental health court? Because road crew or work crew is a tool that judges use if they want to sanction somebody without putting them in jail, and the other alternative would be like sit sanctions or go to the PO's office and sit there, or come back to court and sit and watch and observe court, or volunteer services, like have someone do some community service or something like that. So I hear that they have that, but what I would like to know is, number one, where are we at on our discussion about funding law enforcement positions? Number two, I'm unclear, and maybe they don't have the information, but maybe they do, about if this position, it ostensibly would apply to anybody, right? Not just people that are in our cohort, but people that got a Dewey, people that did a misdemeanor, theft 3 maybe. I mean, it would apply to a lot of people that have nothing to do with our cohort. And so I would want to know, like, what percentage is that? Because I'm not really in favor of just funding law enforcement positions unless it is really directly connected to the cohort and is going to move us closer to our goal of averting people that are in that cohort from criminal behaviors, not just going to jail. But so anyway, that's my kind of overall questioning, and I really don't know where I stand on it because I don't have all the information that I would want to know.
Jeremiah?
Thank you. I would echo the judge's concerns. We liked the initial plan. When you look at what's being reallocated, we're moving away from making sound risk-based release decisions, which was going to be part of the release officer engagement and involvement. We're moving away from housing coordination, which we know is an integral part of success for this population, and components of the other programs, even the last one we just looked at with ADAPT, looking at least at short-term housing, shelter care. We're moving away from medication funds and drug screens, which are good accountability measures and support services. And we're doing that, as the judge outlined, to create expansion of another sanction program. And I get that it's in lieu of a jail bed. But I too would question, is this the best use of these funds, certainly given the broader array and approach that they could have achieved with the other 0.5 FTE positions, to do a broader scope than merely respond to what right now, and again, not having talked with Union County, I don't know if we have somebody available. Most of our jails still have not returned to full capacity since the pandemic, and therefore is this, just a way to ensure that they can have fewer jail beds or don't have to completely reopen or what have you. But regardless, just as it's written and what it's replacing, I'm having a hard time finding a level of support for this. Thank you.
Yeah, this is Steve. I echo Jeremiah's sentiments on this. I'm not feeling it. I sort of the idea of reducing the harm caused by incarceration for this population, I think that's important. But I think what Impacts really envisions is for people with serious behavioral health conditions or revolving in and out of jail, what are we doing with them and for them that helps break this cycle? And it's not just avoiding jail, it's providing rehabilitative and supportive services for folks that include, longer term employment, housing services, treatment, care, and I see none of that here. So I don't see how I get to yes without further information.
I did take a look at our participants, and it does not appear that we have anyone from Union County here today.
I guess I would have one procedural question that I would pose to the group. Not trying to count votes before the vote occurs, but should we reject this program enhancement change that's proposed? We've already approved the program to continue into the next year, and so would think that we would want some guidance from the committee as to what we would want from Union County. Do we want them to continue to try to fill these positions that they have not filled so far? Or do we want them to come back with another package to us at our next meeting? I would just want to make sure, as the administrating agency, that we provide some guidance to them as a grantee. Should that vote occur that way?
Yeah, I think of the same way. So I think what I'm taking away is what they originally planned, we liked and approved, but it seems clear from this request that it's not working out in the way that they anticipated. So I think, and again, not wanting to count votes before we've had the vote. If we do reject this, then I think I would request that they come back with another proposal that meets their needs, but is in the spirit of Impacts. And I think we would be happy to provide some technical assistance and guidance about that. I know Union County is one of the county regions that has just recently received some funding through Measure 110. It may be that the landscape, as it continues to evolve in terms of what services are available, maybe we could help support them in planning for something a little bit different.
Thanks, Steve. I appreciate that. Yeah, and I won't put the cart before the horse. We'll have the vote first, and then we can deal with that question. But I wanted to make sure we considered it before we move forward.
At this time, is there any, further discussion or any questions from grant review committee members? Okay. We will go ahead and proceed to the vote then. So the decision before you now is whether or not you approve the program enhancement request for Union County at no additional cost. Before we go into voting, is there any further discussion or any announcements for abstentions?
This is Steve. Just a further clarification. I meant to endorse the thinking of both Judge Shante and Jeremiah. And I'm sorry, Judge, I neglected in my thinking to also acknowledge your thinking, which I think was spot on.
All right, I'm not hearing any abstentions. So all those in favor of approving the program enhancement request for Union County, please say aye. And those opposed, please say nay.
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 Thank you. Jenny, did we capture that okay? All right, so the program enhancement request for Union County is not approved. And yeah, do we want to circle back to the discussion of what sort of guidance the grant review committee would like to give them? Steve, you had previously mentioned maybe you all can request that they come back with a proposal that more meets the spirit of impacts, and that we are more than happy, both CJC and OHA, to provide any sort of technical assistance, brainstorming, etc.
And encourage them to listen to the audio recording. I think the statements captured the concerns extremely well and will give them a good foundation.
Thanks, Jeremiah. We'll make sure that they get a link. All right. Well, if there's no further discussion or ideas, we'll kind of see general consensus that we'll move forward with asking them to, if this isn't working for them, they're 0.5 FTE community corrections release officer and they're completely unfilled parole and probation housing coordinator. Let's work to figure something else out together. Right. So moving on to the last program enhancement request. This is the fourth one and the final one. The Confederated Tribes of Warm Springs have a program enhancement request with funding of $68,000. The new asks include a $12,000 contract for tribal-based practices, and these would be to groups who are participating in the Impacts program, and then a $8,000 request for the InFocus machine, which will allow them to participate in Zoom meetings and trainings. Right now, they do not have that capacity. And then lastly, a request for $48,000 in housing assistance, which would be housing vouchers available to clients who are being released from a period of incarceration and need assistance with short-term housing costs. And just a reminder, again, this is over a biennium, so this is 2 years. Is there any discussion or any questions? Alicia Beamer? Alicia, I see you're still on mute. Sorry.
Is the InFocus machine for the Zoom meetings and training, do you know more about that? And also just a little more detail on the contract, just for a better understanding.
Yeah, so for the InFocus machine, it's like one of those like projector screens. The camera like speakers for a conference room, that entire setup, to have, you know, those meetings together so that people aren't huddled around one laptop. For
And is that
the-
for the client, the people that are serving to be able to Zoom in for meetings, or is it external or?
I don't think they specified actually. In conversation with them, my understanding was it was for the tribes, let's see, they have kind of like the coordinator for the impacts program. I forget the name of the position, but there is a position that, you know, goes up and directly contacts with all the impacts. So they work in like a team of 2, and they have a manager as well. So I think it was for their use, is my understanding. And to answer your question for the, you know, and more information on the contract for the tribal-based practices, I unfortunately do not have that information. The most that they spoke to it in their budget expense sheet, which is a contract to deliver tribal-based practices to groups and others. I do know that, oh, Dr. Stanfield, you have further information to provide. Please jump in at any time.
Sure. I was just going to say, we had a meeting earlier this morning on tribal-based practices, and I could maybe shed a little bit of light on that. And that is that we at the state, as Steve mentioned earlier, we are working real diligently, and the Warm Springs tribe has always been a leader in this. And so we're really working closely with Warm Springs, and we do need to get someone, and it's not out of these funds, but they were hoping that we could get together, us tribes here in Oregon, and be able to start working on this concept. So I know that they're way out ahead of us in front. They have one tribal-based practice right now. You guys know we have equine therapy, but the Warm Springs tribe has a lot of tribal-based practices. And so because they're so far ahead, I really would recommend, this is going to really help them be able to be a leader in this for tribes here in the state. And then tribes might be able to jump in and do this with their own funding. And also to mention and to remind you that the Warm Springs tribes has their own jail. They're the only ones in the state that does. So I really wanted to help you realize that moving from for people to come in and help when folks are moving from jail back out, or hopefully not going into jail, that this tribe is really advanced in this work. So I just wanted to say that.
Thank you.
This is Steve. I think these requests are really modest. It's probably not appropriate, but I would love to see those increased.
This is Judge Shanti. I'm in favor of this, and I'm Warm Springs, COVID, the whole thing, they have really done just a fantastic job with so many obstacles. So I support this, and I'm kind of on Steve's in his lane about it's a modest proposal, and it looks like it'll do a lot, and they seem like they know what they need. And we should help them build it if we can.
In the interest of time, I am going to ask if there's any further discussion or questions. Otherwise, we should move to a vote. Not seeing anything. So we're going to go ahead and proceed to the vote. The decision before you now is whether or not you approve the program enhancement request from the Confederated Tribes of Warm Springs in the amount of $68,000. Pause, see if there's any last discussion, as well as announcements of abstentions. All right. All those in favor of approving the program enhancement request for the Confederated Tribes of Warm Springs, say aye.
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 Those opposed, please say nay. Right, that sounds like it passed to me. Jenny, have we captured that? Okay. So last little bit here before an opportunity for public comment. Just wanted to give you all an update on next steps. So for our current grantees, their Q8 reporting, the last quarter for the first 2 years, the first grant cycle that these folks had is due on Monday. And that will give us a really good, idea of their total expended funds that they did in the first 2 years. It will also include the narrative reporting component, and I'll be sure to share those with you all when we receive them. That's an opportunity during which, grantees really get to put words to the progress that they've made in the implementation of their programs, as well as the challenges that they're facing and the request for any technical assistance. Sometimes that shows more than data can, especially with the impacts folks. But after that Q8 reporting comes in on Monday, we'll be finalizing the carryover funding amount. And that carryover funding is, how much they had left over from their original award. And if you remember, at the current service level, that was in funded up to amount. So it may be, a case where a grantee underspent, they had more money left over than they anticipated, and their final award amount will be adjusted to accommodate for that. We'll be drafting those contracts, and the first disbursements are scheduled for September 5th for that second grant cycle. And speaking of second grant cycle, our application has closed. We received 4 new impacts proposals with a total ask of around $2.1 million. This afternoon, I'll be sharing an email that will contain a link to a Google Drive. And you'll see 4 folders there with all of their application materials and a score sheet as well to aid you in your review. Just a reminder, like this specific score sheet is intended to be used as a review tool and will help inform discussion the next time we meet, which is Tuesday, August 16th at 1:00 p.m. But the scores will not be the sole factor considered for funding decisions, of course. We anticipate discussion from you all. And if you have any questions in the meantime, please feel free to reach out to me. But just put this on your radar. You've got 4 applications that you'll be reviewing over the next month. And would greatly appreciate it if you get your score sheets to me by close of business on Friday, August 12th. So I'll be here in your email. But in terms of next steps, the next time we will all be together is Tuesday, August 16th from 1 to 3 p.m. to review the 4 new impacts proposals and make any award decisions. So at this time, if there are any questions, of course, from the grant review committee members, as well as questions from the public, this is our time.
I'll just say nicely done. I really appreciate the Criminal Justice Commission's level of organization and professionalism. You make these meetings go smoothly with all the background information and hard work you do behind the scenes. I just want to thank you for that, and for everybody during this summer period that you were able to show up and help fund these programs. Really important. Thank you.
Thank you, Steve. Thank you all for being here today. It means a lot. I hope you all have a fantastic weekend. Take care.
Thanks.
Thanks,
Be
everyone.
well.
Bye-bye.
Bye-bye.
Take care, y'all.